The following interview involves commercial content. The products and services featured appear as paid advertising.
Well, Dr. Andrea Joy Smith has practiced dentistry for over 24 years and established her practice in the Sacramento area nearly 18 years ago. Dr. Smith is passionate about finding new and innovative ways to treat patient needs, which prompted her continuing education in the area of mini dental implants, which she is here to tell us all about. Hello, Dr. Smith.
Hello, Tracy. How are you today?
Good to see you, and good to talk to you a little bit more about this, because I have a lot of questions about this. I didn't know a lot about it until I saw you were coming on the show and did a little research on it, and it's very interesting about dental implants and how long they've been around. I had no idea.
Yeah, they've been around for a very long time, probably going back before the 1960s.
Oh, my.
But in the 1970s, dental implant technology changed dramatically.
Oh, okay.
When a physician discovered that bone will actually fuse to titanium.
Oh.
And with that discovery, it just opened up the widespread use of dental implants to replace missing teeth. But in the last, I'd say 15 years or more, many dental implants have gained in popularity as a way to replace missing teeth as well as secure dentures.
Okay, and tell our viewers who don't know about mini dental implants, what exactly are they?
They are small medical devices that are used to replace missing teeth. And rather than using a larger conventional implant in patients that typically don't have a lot of bone because they've been missing their teeth for a while, they can be used in areas where there is a lack of bone in many instances.
And you've been coming on the show for a couple weeks now, educating us about this, but we haven't really talked a lot about cost, which I know is probably the #1 question everyone has. Is it expensive? How pricey is it?
Well, cost is really one of the main questions that people have. And without an accurate, treatment plan and imaging, it's hard to give an exact fee. But what I can say is that mini dental implants are about half the cost of traditional implants.
Oh, is that right?
And that's based on the fact that there's fewer surgical visits, it's less invasive, and the technology for placing them is just a little bit different.
Oh, okay. And you have a little bit of a video that's going to show us kind of a little bit of the procedure.
Yes. Well, this procedure here is that's being shown is showing how we can use small diameter implants rather than the large ones to insert them into the jawbone so that a denture can be placed right over the implants and snapped into place, as that video will show.
Okay.
And in general, they're replacing the root of the missing tooth there. And by adding a few more implants, we can then snap the denture in place, allowing the patient to no longer need denture adhesives and things of that nature in order to secure their dentures in place.
Oh my goodness, look at that. So it's almost like a ball and a socket type thing? Is that a little bit? Okay.
That describes it exactly.
Okay.
It is like a ball and socket that snaps that implant into place. And those little round O-rings that you saw there, they have to be changed every 6 months or so because they do tend to wear.
That was going to be my next question. How often after you get the procedure done do you need to go visit the dentist?
Well, as we say in dentistry, all patients need to see their dentist every 6 months.
Yes, that is
so
true.
it's no different from implant-supported teeth. So it is very important that you see your dentist at least every 6 months, whether you have natural teeth or implant-supported teeth.
And so can you tell us maybe about some of the cases that you've had here in Sacramento and what you performed on those folks?
Yes, I've performed a wide variety of cases. This particular patient came in needing a full mouth reconstruction. So we were able to place implants to replace all of her teeth because they were no longer restorable. And her after smile is very beautiful, as you can see.
Oh, wow. That's amazing.
Yeah. And I have seen patients like her and patients that only have a few missing teeth. In this particular case, this patient was wearing an upper denture, but hesitated getting the lower denture because of the adhesives and just the general discomfort in wearing an upper denture. So we were able to do a full mouth reconstruction with her as well by placing a requisite number of implants on the top and bottom and then securing those into place. Now those are actually cemented into place. They do not come in and out for both of those patients that were shown.
Oh my gosh, those smiles are unbelievable.
Yes, very happy patients.
Very happy patients because it's the first thing you notice on somebody is their beautiful smile.
It really is.
And that's a huge change. Wow. So once they get the procedure done, what's the maintenance like?
The maintenance at home is just as important as it is for implant-supported teeth and natural teeth. So we can use a regular toothbrush. I actually prescribe all of my patients a water pick because for those appliances that don't come in and out, you'll want to get in there and really clean those surfaces well. We also have a specially designed implant toothbrush that can be used as well.
Oh, wow.
And flossing is important as well, but it has to be modified to use a floss threader so that you can get under the implants.
And quickly, tell us about folks that might be missing one tooth.
A single tooth can be replaced with a mini dental implant. In fact, it's one of the easier procedures that we do. It normally takes well under an hour for that procedure to be done. You'll come in with a missing tooth. We'll place the implant, and we'll put a temporary tooth on that very same day.
Oh, good. Oh, that's fabulous.
It works out really well.
Where can folks go for more information?
Well, of course, they can call my office at 916-482-8300. They can also find us on social media, Instagram and Twitter, at Dr. Andrea Smith, and our website, DrAndreaJoySmith.com.
Fabulous. All right. Thank you so much for being here.
Well, thank you for having me, Tracy.
All
It's a pleasure.
Thank you. Well, coming up, see what's new on the menu at Togo's. Zach and Co. We'll be right back.
This segment was paid for by Dr. Andrea Joy Smith.